Thank you.
Good evening. Thank you very much for that introduction and the welcome, Khalid. It's really very nice to be here. I would like to especially welcome the youngsters who are registered for this evening session. And I'm very grateful for all the seniors who have logged in. I'm really grateful that they have chosen to spend the time. And I would like all of us, including me and all of you youngsters, students, to use their time productively. I know that Rajan, for example, has a very good topic on dissertation, or a talk on dissertation. I've heard him at least on a couple of occasions talk about this, which is very nice. There are many other seniors here and professors, and I would very much like their active participation. So this should not be like a lecture. I would much rather we have this as a discussion, an informal discussion. So to all of you who are logged in, feel free to interrupt if you want to add some comment to what I have to say, if you agree with me or disagree with me, so that all of us together come to some kind of a consensus about what we have to do on this subject. Now, what I would like to do is start with fundamentals. I know that this talk is particularly aimed at first years who have just entered their MS or DNB course. It's not really meant for the seniors who are at the fag end of their MS or DNB course, but the first years. And so we need to keep it very simple and very fundamental. And even that may sometimes be overwhelming. And so I would like to basically start with why do we even think about a thesis, tell you what a thesis is, and then come to the meat of this talk or this discussion, which is how to choose a topic for a thesis. And of course, once you choose a topic, it doesn't end there. You need to also hold you and see how we can help you finish that study. And of course, writing it up is another topic, and that won't be touched on today at all. We need to understand the fundamentals of surgical training. What are we trying to achieve, the teachers and the universities and the country? What are we trying to achieve when we put you through a 3-year course, either MS or DNB? I really don't differentiate between the two in any way at all. I think we're all in the same business of having a safe, efficient, scientific, and an ethically sound surgeon. At the end of the day, we have to let loose on society a person who is capable of doing safe surgery and doing it efficiently, and after taking a scientific view of the problem and getting a scientifically valid solution, which essentially means you make a decision to operate or not operate, choose the operation, do the steps of the operation, everything based on evidence and based on science. And that is an important thing. And I keep saying this word science because that is the essence of the reason for people in power, like the DNB board or the universities, asking you to do the thesis. Please remember that. All the learning that you do to meet those requirements, which I described in the previous slide, are under only 3 main headings. One of them is the theory part of it, which is called the cognitive ability. Second part is your skills as a surgeon. Surgery is a hands-on thing, skill-based science, and so you need to have what are called psychomotor abilities. And of course, ethics is something which we just learn, and probably by imbibition as we go along, see people, face situations, and do something which is ethical. I'm not talking about ethics today, but my primary goal is to fit in the idea of thesis between, inside this subheading called cognitive skills. Cognitive ability is something that we have to give. How do professors and teachers give you this cognitive ability, give you the capacity to understand the theory? Basic didactic teaching is actually not very good. In fact, what we have to be doing is guiding you. And most of the learning is done by yourself, the postgraduate students. This is a fundamental and a paradigm shift between undergraduate training and postgraduate training. Please remember that your professors are not going to spoon feed you information. They're going to help you set goals yourself. Please note my words. You have to set the goals. You have to do this. They're going to help you find sources of knowledge. They're going to promote discussion and make you face a problem head on, be it surgical, be it whatever else, and then help you find solutions. So in the course of the last 30 seconds, I have told you, you several times. Why did I do that? I have to say that the first thing that I need to impress upon you, a take-home message from today's discussion, is that you are going to be working for your learning. It's not that somebody else is going to work for it. And to do that, you really need to put your whole and soul and first understand that research is as much a part of your learning surgery as anything else. Most youngsters, including me, I went through the same phase. When we enter surgery, we feel the first thing we want to do is get hold of some knife, cut somebody up, get hold of a suture and suture it. We think that cutting and suturing, we feel that is the be all and end all of surgery. But nothing could be further from the truth. What you have to do to be a good surgeon is to learn some basics of research, which helps you become very good at your cognitive ability. And that is important. My teacher, one of my professors in the UK, used to tell me, they used to call me Krish, and they would say, you can teach a monkey to operate, Krish, but you can't teach a monkey to take decisions. So taking decisions, doing the right thing as a surgeon needs good cognitive ability, and a big cog in that wheel, a big part of that cognitive ability learning is research. It helps you document your work. It definitely helps you improve standards. It helps you conform to international standards. That's very important. We should have a world view of our work. We should be able to stand in front of 100 international surgeons, not somebody from South Bangalore or Ballari or Vijayanagara or wherever else, or Mangalore, but in an international audience. It's a world is flat today. And then you must be able to talk with confidence, with numbers, and preferably with your own data, to say that what you're doing makes sense. I have dealt with 300 of these patients, and this is the outcome. And that is why I'm saying that this is a good thing for the patients. That capacity you must have as a surgeon to prove yourself in this world. And it helps you to be very truthful and factual. And once you start looking at your own data, then you can compare that data with the world standards. A process called audit, I won't go into audit today. Then you know where you stand in terms of the world standards. And if you think you are not as good as somebody, you should become one. You should work hard, learn more, and become as good as somebody else. Because I've always said that, surgery is a talent or a science that can be learned. It's not God-given. It's not a Brahma Vidya, as they say. And so everybody can become a good surgeon, provided they put in the effort. So to know where you stand in the field of surgery, you must have research. Now, more and more people have written about it. I don't want to dilate on this because I want to get back into the meat of the issue. But there are two quotes which I would like to really read out again to you. You can see it on the screen. Without inquiring minds, medicine will stand still. That's a very clear-cut view, which means that we can't keep on saying something because somebody else said so. You've got to question yourself, question what the system is, question why we're doing what, in a very nice and a very scientific manner, not in an arrogant manner, and then prove to yourself that what you're doing is right. And robust research tools are needed to evaluate one's own practice. Unless you understand what good evidence is, what good research is, you can never really evaluate your own work, evaluate somebody else's work, and not being able to evaluate somebody else's work, you will adopt methods which are not scientifically proven just because somebody else said so. That doesn't work in regular practice. I would strongly recommend that you read this paper from the BJS in the year 2000 from a chap called Shine, who is extremely good at communication. He has written a lovely book on emergency surgery. He looks at egoistic motives and altruistic motives. Egoistic may not be very, very important, but we must also look at the altruistic motives. Why? We need to disseminate knowledge. We need to be selective in our, that's called research selectivity, a process where you select areas of interest that you have and then get good at it and then provide data for the rest of the world. All of us cannot work in all fields. That's very, very clear. So you choose areas of interest and work on it. Now, you may say, the youngsters may say, you're talking about your surgical practice, your surgical teaching and your surgical knowledge and science. How does it affect me as a first year? Now, unless you start in your first year giving the importance to these aspects of surgical knowledge, the same importance as you would to doing an appendix or a hernia, you will never be able to reach the stage where you are very, very objective and evidence-based in your practice. All right, I would like to take a little break here and invite the seniors in the group to add their bit to this part of it, please. Shivram, do you want to add anything to this?
No, Dr. Lakshman, I think most of the things you have covered perfectly, very well said.
Arvind?
Sir, nothing to add, honestly.
All right, okay. Chanana sir, I see you there. Can you unmute yourself, sir, please?
Hello, sir. Good evening, sir. Lakshman, sir.
Good evening.
Yeah,
good evening.
Everything, sir. It's nice.
All right. Okay. Thank you. So let me go to the next section. You know, I have my talk in 3 or 4 sections. And so let me go to the next section. Let's learn a little bit about what a thesis is and does it really differ from a word called dissertation. Most of the time they're used interchangeably. Okay. Somebody calls it thesis, somebody calls it dissertation. But if you look at the, the finer details of the definition, dissertation is always time bound, which means that you have to finish it in a given period of time. So what you do in your MS or DNB course is strictly a dissertation. A thesis, it also has some time, but it's not as strict as it is in the DNB or MS. You know, it can be a PhD. Your PhD project may go on for 3 years, it may go on for 4 years, sometimes 5 years. So the difference between the two, what is done is the same, but the difference is that dissertation has strict timelines. Now, is the dissertation, I'll use these words interchangeably. I may call it dissertation once, and thesis seems easier to say, so I'll probably say thesis more often. Is the thesis between DNB and MS different? Because I'm addressing this because I'm talking to both groups of people. There is no difference at all. What is expected of you in the two streams of surgical training is the same, but there are very minor differences in terms of deadlines, and I try to go into the RGUHS university to know what the exact time frames are, what are the exact deadlines, and to be very honest, I couldn't get an answer. But I do know, I'll tell you as we go along, that there are small changes in the timelines as far as the submission of so-called synopsis, submission of the finished product, finished thesis is concerned. And what really changes in the two is the application of the rules. It seems to me that the DNB people are a little more strict in how they apply the rules. The rules do exist in the university, but correct me if I'm wrong, but it seems to me that they're not that rigid in the way they apply or execute the rules that apply for submission of a thesis. Now, I'm going to repeat this, which I've said this before. A thesis work should not be seen as a chore. It's not something that you do because you have to do it because somebody is forcing it on you. The first lesson all youngsters, all first years must learn is that it is an important part of their training. That's a very, very important thing. And it should be done with diligence and I wish I didn't have to put the last line. The last line says done with honesty. Why did I put it? Because I've seen time and again among many, many students, among many, many units across the country, definitely across the state, where people are dishonest with their data. And that is cheating themselves and cheating the world and treating it in a very, very bad way. I'm using strong words and very clearly, because if you don't get enough patients, you just add a few patients on. You miss finding data somewhere, you just add something on. Please never do that, because people, if you have to have respect, and if you want the system to have respect, if somebody must respect a thesis from the DNB board, from the country, or if they have to respect a thesis from the RGUHS, then they must know that the data is honest. And that is all I'm going to say about it today. But please remember, you've got to be ruthlessly honest. So the next thing that we ask ourselves is, when do you start work on the thesis part of your course? We have established that it is as important a part of learning as learning surgery itself. When do you start? Do you start it on day one? Do you start it after 3 months or 4 months, 6 months? When do you start it? I submit to you that you must start thinking about the thesis the day you join your course. As much as you think about anything else, as to where you have to discover where the radiology department is, what is expected of you as a first year, where is the blood bank, where do you get blood, exactly on those lines, where you spend your time on patient care. You must think about, how do I go about getting my thesis work done? That is the kind of enthusiasm and the kind of attitude that you must have. I told you that I'll tell you about the timelines, and I'm subject to correction in this because I could not get official data from anywhere. So I have spoken to some teachers that I know of. I've spoken to people who have just passed out, and the information I get is that in the MS, you are supposed to give a synopsis, which is a summary of what you're going to do for your thesis between 3 and 6 months from the time of joining, and that you must submit your thesis 2 years from the date you submit your synopsis. In the last 2 years, DNB people have done away with the submission of synopsis. They don't care whether you submit a synopsis or not. Nevertheless, you need it to get permissions that are required. I'll tell you a little bit more about it as we go along. So you need a synopsis, but there is no deadline for DNB people to submit a synopsis. But they must, and they are very, very strict about it. They won't let you take the exam if you don't do it. You must submit your thesis 6 months before you sit your final examination. And I know myself of my students whose thesis has been rejected after it is submitted. That probably never happens in MS, extremely rarely, but in thesis, in the DNB, they do take it seriously, and they do say that this should be corrected. All right, so please understand. And so the timeline I'm going to recommend to you, the timeline I'm going to recommend to you is that you must have a synopsis ready 3 months from the time, 3 months from the time you join your course. All right, remember this. You may think it's very tight, but if you start thinking about thesis on day one, this won't be very tight. 3 months from the time of your joining the course, get your synopsis ready. You have to start your study 4 months after you join your course. Why? Only when the synopsis is accepted by all the people, including in your own hospital. You know, I'll tell you about what are the permissions that are required as we go along. Once it is accepted, you can start your study. You will need 18 months for data collection. Remember, you have to submit your thesis 6 months before the final exam. So you will need about 6 months to write it up. It's not easy to write a whole thesis, 100, 120 pages long very quickly. So you need to have data collection. Remember that a part of writing up is getting your statistics done. Again, I'll tell you more about it. You have to have 6 months to do all the work after you finish your data collection. Remember that. So you need 18 months at least for data collection. So to recap, start getting your synopsis ready within 3 months of your joining, start your study in 4 months, and you have 18 months for data collection. Now we come to the very essence of this talk, as it were. What are the kind of questions that you ask, or the kind of topics that you choose to select a thesis, a topic for the thesis or your dissertation? Now, you can't, it is really an overwhelming thought for a first year who has just passed out of his MBBS, who comes in as an MS or a DMB student. Don't get overwhelmed. The process is not as complicated as you think. When you talk to people, okay, you will be able to get all the answers, but you must know what are the questions to ask to talk to people. So what you will not know about your hospital and your unit or wherever you're working. But what you need to know to choose a topic are these 4 questions. What are the common cases that we do? Why do you need that? Because you need data, you need patience. So if you find an esoteric subject where you cannot find cases, you cannot write a thesis. There must be a relatively short follow-up. If your research question, I'll tell you about research question in the next 2 to 3 slides. If you have a question which needs a follow-up of 3 years, it's out of the question. It's common sense. You understand? So you have to have a question for which you get an answer within 3 to 6 months, so that by 18 months you get enough numbers to get some answers. And always, all the tests, all the topics and all the studies that you do will have some tests that have to be done. So those tests must be readily available either in your own hospital or at a reasonable cost at a very nearby laboratory which is dependable and which is within the reach of whoever is spending the money. And understand that it must be a reliable, validated test. So availability and reliability of the tests that you want to perform in your study, that is something you must have. And as I told you, tests cost money. And so you can't burden the patient with a cost for a test that is not clinically required. So most of the time you choose such tests which are done in the course of the clinical care of the patient, and then you can cover your costs without burdening the patient. And if some test has to be done because of the study and not within the realm of clinical care, then you can find people who will fund you. I'll tell you, only touch very briefly on it later. Maybe we should discuss it some other time. But yes, there are sources of funding that you can get. But to do all this, remember, within 3 months of joining, within the first 1 to 2 weeks, you must be proactive and keep asking. Who do you ask? You ask your immediate seniors in your course, second year student, third year student. Ask your staff on your unit. Ask your chief, the chief of the unit. Talk to other chiefs of the unit. But understand that you don't expect them to come and be on your back to say, look, do this. These are the 5 topics that I would like you to study. Don't expect them to give you the topics. You go and talk to them, sir, what are the things you think I can do? What are the common cases? What are the kinds of questions that I should ask? You be proactive, and I can tell you that every single teacher will be very happy to have a student who comes and asks them these questions. Now, the next step that you have to do is to know about existing studies, okay, and to learn about literature search. But what I would like to do is go back one step and give you some simple examples of topics to choose, which are common, which are generally available in most of the general surgical units, and which you can think about. And hernia, groin hernia is a very common topic. There are different aspects of the hernia that you can study, and I'll come to that later. Groin hernia, ventral hernia, ventral hernia, umbilical, epigastric, incisional, ventral hernias, diabetic foot, very common, peptic ulcer disease, gallbladder disease, colonic carcinoma, for example, gastric carcinoma. Most people, unless you have a specialist cancer hospital elsewhere, you may not get oncology cases, but otherwise, I'm sure in many teaching hospitals, oncology cases come up as well. Sarcomas you may have. You may have chronic venous ulcers, venous disease. Whatever examination cases that you can think of, that you prepare yourself for, are also research cases. Please remember that. I will talk about the type of study and the literature search a little bit. I'll take another little break here and leave it to the seniors to say if they have anything more to add, please. Chanana sir.
Sir, regarding Dr. Nooli sir was asking about committees.
Yeah, I'm not reading the chat, so somebody else will have to read the chat, because if I put the chat up, I may end up having a black square on the screen. So kindly, Divakar, I've made you a host, so if there's something in the chat, please put up that question to me, please.
Yeah, Lakshman, only you can make,
sir.
he has logged out as a
Arvind.
co-host, so you have to make him co-host once again.
Oh, I see. Okay. All right.
Sir.
I will. Just one sec. Let me do that then, and then we will. Yeah. Or I can make you a host if you like. You're a co-host already.
Yeah,
okay.
yeah,
So you can read out the questions to me,
Yeah,
please. Yeah.
I think Dr. Nooli has asked a question that thesis committee, is there in the department, is there any thesis committee?
Yeah.
And their members and their functions, and are there any review meeting schedules to check the progress? And can
Alright.
we take financial help from pharma?
Yeah.
That's the question from Dr. Nooli.
Can I address that a little later, because we'll give them the basic issues first, and then in the end, kindly remind me. I will talk about these things, and then involve the others. Yeah.
I'll do that.
Right. Please. Yeah.
sir.
Rajan, do you want to, Arvind, please.
Yes.
Go ahead.
Yes, you have touched this, especially honesty in writing a dissertation.
Yeah.
As far as my knowledge goes, it is lacking. Absolutely, it is lacking. Many of the medical colleges, especially government medical colleges, DNB, I do not know. And regarding selection of a topic, to know the caseload in that particular hospital where the postgraduate is doing, it is worthwhile going back to the retrospectively, seeing the caseload in that hospital and trying to get something out of that, so that he or she can plan for the dissertation topic. Thank you.
Rajan, you have something to add?
Just that, remember, in the DNB system, we also have post-diploma students who have only a 2-year course.
Yes.
And their dissertation time is just condensed very much more. They
Yes.
get only about 1 year of study time.
Yes.
So that has to be kept in mind. So
Sure.
it hurries up all the steps for
Yes,
them.
certainly. Yeah.
Thank you.
Please
All
make Dr. Divakar also co-host, Dr. Lakshman,
Okay, I will do that.
so that we both will monitor. Yeah.
All right. Just give me a minute. I'm just trying to find his name in this long list. Yeah. Divakar, you are a co-host now, please. Yeah. Okay. All right.
Thanks,
So, okay. So now we need to learn a little bit. I'm taking you step by step. So as a student, you go talk to your seniors. What are the common cases? If as Arvind suggested, yes, if you can go to your medical records department, and if you get access, and if you can see what are the common cases that are done, even better, but that may be a bit of a challenge. But you can talk to your seniors and say, what are the common cases? Then you have to know a little bit about the case. You will not know anything about the operations for a hernia, operations for a gallbladder. What are the alternatives? So you need to do a little bit of literature search to know a little bit about your interest area. Okay. So say you have decided to learn about gallbladder surgery. Then you can read up about gallbladder. Your standard textbook reading will not be enough. So you need to look at the literature. And when you look at the literature, I think what you have to do is look up what is called the PubMed and the PubMed Central, or a thing called Google Scholar. If you do a normal Google search on which you choose your watch or your whatever else that you buy, or a book that you buy, or whatever else, a normal Google search will not serve the purpose. It will throw up a lot of things, but it's completely useless as far as scientific knowledge is concerned. So you need to go to, remember these names. You will have this dissertation, this presentation in your boxes. I'm going to share this presentation with you, so you don't have to take notes. Go to something called PubMed or PubMed Central, and then do the search. It won't be easy. You may not understand what I'm saying now, but as we go along and as you start discovering it on your internet search, you will understand what I'm saying. And that is important to do that. And another easy thing for you to do is to go to kscasi.com. Please remember this. The state chapter of the Association of Surgeons of India has a very good website with a lot of information on it, which is unfortunately grossly underused. I would strongly recommend that you go to kscasi.com and all of you can see this. And then when you go to the next page from the, and then press on this thing called research methodology, it will lead you to another page which gives you a lot of information. You know, some of the good talks from very senior teachers of the state have been put up. You can read that, you know, you can see those and learn from there. But you also have a whole lot of links for a research and evidence-based workshop that we have been, you know, we have been doing for some time now, for a year now. And then that will give you details of all the things, and you can also access videos. You know, you have to sit down and listen to a video which is probably 35-40 minutes long for each of these topics. Some of them are only 20 minutes long. So take 2 to 3 or 4 days and get into this kscasi.com, get into this particular page and read up about what you do to get literature search, and it actually handholds you. It tells you step by step what you need to do and learn about literature search, about what is a good evidence and things like that, which you will not know at all, okay, at this point in time. So I told you, to recap what I've been saying from the beginning, the first thing you must do is learn and take home the point that thesis work is as important as learning any other aspect of surgery. That's number one. Number two, you must take it to heart and make it very clear to yourself that you must start early as possible about learning and taking further steps about thesis. Number three, you have to be proactive. You have to go to your teachers and your seniors and get to learn. And number four, you have to go to kscasi.com and look up these topics which are explained to you in detail, and spend maybe 2 hours a day for about 3 to 4 days, and you will get all the ideas that you want. Okay, that brings us to the present slide, which you must, once you choose the topic, the next thing you have to do is know what kind of study you're going to do. Again, my objective for today's discussion is not to describe the various kinds of study. Broadly, there are only two kinds, prospective or retrospective. As I told you, when you use a prospective study, you must have a short follow-up. Otherwise, you won't have enough patience or the duration. You won't have enough time to complete your study. Retrospective study gives you a little more leeway because you're going back and not recruiting students, patients, prospectively. So you don't have to wait for patients. You're only analyzing data that comes from patients who have already been treated in your hospital and your unit. But the value of a retrospective study is limited. Why it is limited is something that we'll go to later. And the second important drawback of retrospective study is that when you have a protocol, I'll tell you what a protocol is. When you have a protocol, many points in that protocol, many data points or information that you have to have will be missing because it's a retrospective study and it may not have been recorded when the patient was in hospital and you have no way of getting that information now. So you will have gaps in your data which will make your analysis a little difficult. So in terms of value and control and the effectivity of your study, prospective study is better, but you will have difficulty getting patients, and that may be a limitation. But in terms of having a larger number, retrospective study is better, but you will have problems with getting all the proper data points, and analysis may be a difficulty. Having understood these advantages and disadvantages, you can talk to your teachers and decide what you want to do. But the next important thing that I would like to stress on is that apart from the area of study, you must also have a research question. This is crucial, and I will spend a little bit of time on what a research question is. To answer this question, I would like you to listen to me carefully on this. We need to understand what is not a research question, what is not a study. When you do not have a kind of question that you're asking yourself in the course of your study, you do not have a proper study. So what is not a study? A study which lists certain events of a given operation. I'm going to give you statistics for, examples for each of these. Now, you decide on having a retrospective study on the outcomes of your laparoscopic hernia repair. Okay, your hospital does TEP. Okay, and you said, how did my TEPs do over the last 2 years? So you go back and say, look, I had so many males, I had so many females, it took me this much of time, and we had so many complications in the intraoperative period. There is not much of a follow-up, so you don't know how often they came. And then when in the follow-up, you probably have a listing of the real problems or not. You don't know how many came and attended the OPD. Even if you have the data, you say, okay, so many people had seroma, so many people had this. So you're just mentioning facts of a cohort. It's called a cohort of a group of people who had say a laparoscopic hernia operation. Take it from me, that is not a study, because it doesn't have the fundamental requirement of a study, which is a research question. Now, the same topic of laparoscopic hernia can be converted into a good study by asking a simple question. Okay, what is that question that I'm talking about? You can compare. I come to this next line of this slide, comparison of groups. Now you can say, I will compare my laparoscopic hernia outcomes with my open hernia outcomes. I'm sure your hospital does open hernias also. So it's the same groin hernia. You have one group which has 20, 30 laparoscopic hernia group, another group which has 20, 30 open hernia group. You're doing a prospective study. You drop what are the points that I'm going to ask in a protocol. You also say I'm going to ask them to come at these regular intervals, and each time they come, I'm going to ask these questions and evaluate them for these things, either clinically or if necessary in addition with extra tests. So you have two groups on which you are asking the same questions and doing the same tests, and then measuring the same components like pain, return to work, for example. You can compare the incidence of seroma. You can compare the incidence of chronic groin pain, defined as pain for more than 3 months. Of course, you can mention about recurrence rates, but it will be of limited value because recurrences occur maybe many times at the end of 2 years, and you can't have a study that goes on for 2 years. So you will say, I'm measuring the pain for 4 or 6 months, and then I will decide. Now you have two groups. So when you have two groups and a set of data, then you can apply statistics to know that the difference between these two groups are really valid, really true differences, and not because of a chance occurrence. Okay, that is the value of statistics. If you listen to Dr. Ramakrishna's talk on statistics, basic statistics in the list of videos that we showed you earlier, he beautifully explains how differences between two groups in nature can be just by chance. And so you need to prove to yourself and to the world that the differences that occurred were really true and not by chance by doing statistics. All right. So these essential things in your study include having groups with similar data measurements. And before having the groups, you must have a research question, and you must have some statistics to prove that the changes, if any, between these groups was not by chance, but because of the intervention, because of the because of the medicines that you gave or the operations that you did because of your intervention. All right. So that brings us to the last line on this, the confounding factors. If you look at all the studies that we look at, the thesis that is done, that are submitted, and the papers that are submitted, our young students have no idea what a confounding factor is. So I'm going to, and that's where we keep on trying to tell them, please look at the confounding factors. I will give you a simple example for this, and I hope that it is simple enough for you. Now, many people have looked at the change in the liver function tests based on the pressure of carbon dioxide in laparoscopy. For the very beginners who don't know, we create space when we do laparoscopy by putting carbon dioxide in. Now, if you keep the pressure in the abdomen at 10 millimeters of mercury, there's a degree of hemodynamic change which will have some effect on the blood supply to various organs, including the liver. Now, that can give some changes in the liver function test. Now, if you have a pressure of 14 millimeters of mercury, then that will have a bigger effect on the circulation to the liver, and then that can have a different kind of effect on the liver function test. Now, the question is there a difference in the LFT? That is a research question, mind you, in the liver function tests between having 10 millimeters of mercury pressure or 14 millimeters of mercury pressure in a patient undergoing any laparoscopy operation. All right, but then the commonest laparoscopic operation is gallbladder operation that all of us do. So invariably in that group, you'll probably have a good number of people who are undergoing laparoscopic cholecystectomy. Okay. Now, just think about this. What are the confounding factors in this? Particularly when there is gallbladder disease. Now, there may be a stone in the bile duct that can cause changes in the liver function tests. There may be an infection in the gallbladder that can cause changes in the liver function tests. People, the anesthetist might have used halothane that can cause change in LFT. There may be other drugs that may be used which have an effect on the LFT. So the point I'm making is that when you have a change in these two groups in the LFT, in the liver function test, you cannot say that change was only because of the change in the pressures that we used. You cannot say it's because of 14 millimeters of mercury pressure versus 10 millimeters of mercury. So these factors, other than what you're studying, in this case, as you recall, it was the intra-abdominal pressure of carbon dioxide. Now, factors that can change the parameters that you are studying other than the intervention are called confounding factors. And so when you design your study, you have to take extra care to make sure that either there are no confounding factors at all, or that the confounding factors occur with the same frequency in the two groups. They even out when it is the same frequency in the two groups. So this factor is something which most people miss, and you have to give your attention to it. As a first year, you will not be able to look at all these confounding factors. This is where talking to your teachers becomes extremely useful. So when you think of a study, be it a hernia, be it a gallbladder, when you're looking at a particular factor, ask a research question, draw up a protocol, and take that protocol to your seniors. Okay, and when you do that, they will be able to say, look, there are other factors which are working in this and you have not accounted for it. And so they will also, you can also work out how you can account for it, or take their advice about how to account for it. Okay, I will stop here again. And now we come to the question that Dr. Nuli had asked, but we will discuss this later. Can I go back one slide there and then request our seniors to chip in, please?
Yeah, Dr. Lakshman.
Sir.
Dr.
Sure,
Shubram.
Kelly, sir, sure.
No, if I look at the postgraduates, how they search for the thesis, they go back to last 3, 4, 5 years, all the thesis done in the university or in the DNB board, and then they start searching in that some thesis topic. I think that's not the way to do it. But
Correct,
that's
very correct.
promptly done.
Yes,
I think that should be told to them. Don't
Yes.
go in that direction.
correct.
Please go in the right direction. So
Very,
that
very
is-
true.
Yeah. I think that's a wrong way to go in search of doing thesis. Other thing is what teachers can do to
We lost you for a bit, Shivram, there. We lost your audio.
Not audible.
Not audible, Shivram.
hello.
Now we can hear you. Please go ahead. Yeah.
Now, what as teachers we can do
Yeah.
to motivate these fresh DNB candidates
Yeah.
to start their thesis work?
Yeah.
That's not happening. Even though we are behind them, somehow they are not motivated to start their work.
Yeah, that's a very difficult question. Yes, it has been my experience for the last 13 years that I have been helping DNB students with their thesis. Somehow people do not think that that thesis work is an important part of their surgical training. That has to be digested and accepted, and happily so, not because of somebody's pressure, but people must understand that that is an important part of their training. Young students must understand that. Anybody else? Rajan?
Rajan.
Yeah, there are two things that I'd like to add on here.
Please.
I do ask the students to go and look at the previously done topics and tell them that these are the topics that you cannot do. These are the ones that get excluded, and you have to think of something else in alternative. You can use the idea, but you have to think of a new variation or a new aspect of that study. The second is I have tried, I'm not very successful, but I have tried to link it to the operative chances. Until your dissertation thesis protocol is shown, you're not going to be more than second assistant. That was the initial days. And then as they did their study and the things started moving along, we made them first assistants and things like that. So I don't know if it is correct or wrong, but unless you show a whip, the donkey does not pull. I'm sorry to use such terms, but we need to show some amount of relation to the work in acquiring of psychomotor skills in connection to the cognitive skills, the amount of learning that you're doing. So is that possible? Will it be done? Will it be accepted to be done? Very, very moral and ethical questions. But I feel that some amount of connect should be there between psychomotor skill acquisition and cognitive skill acquisitions. Thank you.
I agree with you, Rajan, and we have been doing that also in Sagar, but it doesn't work well. I can tell you, it doesn't work very well. Yeah. Okay. Any other comments, please, from the seniors?
One particular point which I just wanted to mention is Chandana is here, and I don't know how many professors are here.
I think he wants to make
Normally, hello.
Dr. Chandana wants to
yes,
make a
yes.
comment. He's raising
Please,
his
sir.
hand.
Please go ahead, sir. Please go ahead, sir.
Okay, Chandana.
Yeah. So actually, like students should be what you have told in your this one should be proactive. They should have. Only thing from our side as a teacher, I have to create interest in them, and whatever thing is there, the topics, and majority of the people, the student, they don't know how to search literature. They don't know, they lack all these things. So that needs to be stimulated, and CME like webinar like this should be arranged in the first 4 to 6 weeks, so that they will have some interest towards this. It has become a routine, like the student will ask them to submit some list. They will be coming with some reluctance. So that part will have to take care. That is the one thing. As a teacher, you have to create some interest.
It's a very valid point, and I can assure you that the EC of KSA ASI is working really, really hard to actually make it compulsory. At the moment it's not compulsory, but yes, if more and more people like yourselves who are teachers in various institutions, if you want us to do this kind of literature search and, choosing topics, the whole lot of things. We have enough knowledge and enough experience and enough enthusiasm to do it. In fact, we are trying to make it compulsory so that students have to go through this in the first month of their joining a course. We have in fact approached Rajiv Gandhi University also. The progress is slow, and hopefully we may have some progress in the near future, sir.
Sir,
Hello, sir.
as Rajiv Gandhi is insisting for, University Rajiv Gandhi is insisting for an introductory program for the newcomers.
Yes.
So they have to incorporate this in that program only.
Yes.
This should be incorporated in that, so that
Yes.
it will be a routine for every batch whoever
Yes.
joins for the.
So one of the things that I have discovered is that in fact many institutions have such programs. Many of them have it, and they really feel that this may be redundant. But I've also discovered that those programs are rather theoretical, more epidemiology oriented rather than surgical oriented. And so our endeavor has been to make it very, very kind of focused on surgical literature search, surgical topics, and making, bringing up surgical protocols. And so I think there's a role for both. Instead of saying that is not good or this is not good or this is good or things like that, maybe the students can go through both and then get the best of both worlds and learn these essential skills. That's what I felt. Yeah.
Sir, I'm Dr. Girish Kololi, sir.
Please, Girish Heli. Yeah.
Sir, this time there is a little change in our thesis selection topic, what our students do.
Yes.
This time our principal had called interdepartmental meeting, sir.
Right.
Dr. Arvind Patil.
Yes, sir.
He had called Dr. Arvind Patil, our principal.
Your principal, yeah, at Bijapur. Yeah, okay, yeah, go on.
Sir, he had called interdepartmental meeting. He had told us that 30% preference has to be given to our side branches. 40% you keep for surgery, under 10% you can mix up those things. So that way, even our numbers had increased in the BLD, sir. This time, last time, 7C, we have made 12 PGs. So that those PGs will be benefited by, if topics are less also, we can take related, like anesthesia related, microbiology related, or pharmacology related. So
Now you know.
Hello.
Yeah, please go ahead. Some disturbance. Please go ahead. Yeah.
Sir. Sir had kept a meeting, so we have to choose topics which are related to them and so which are helping them also, so that they can become a co-guide. So that in that way also we can get benefited to them also and to our surgical department, sir.
Yes, yes. See, this partially answers Dr. Nuli's question. I'm going to give some more answer and say how we do it in Sagar. But yes, Arvind, you have your hand raised. Yeah.
Actually, I wanted to talk about that subject only. If at all there are number of cases or whatever may be the reason, if the caseload is less, we should, that means the teaching faculty should allow the students to take the help of private cases also outside the hospital, if it is done in a honest way. So in that way, we can definitely give the wide range of topics.
Yes, yes, that's a very valid point. I think it's very, very useful. Any other comments on this subject, please?
I think Divakar has raised a hand.
Yes, sir.
Divakar, please.
Yeah.
Yes, sir. As far as the postgraduate who joins the medical college is a newbie, he doesn't know what kind of cases he will be getting.
Yes.
Hello?
Yeah, please
Yes,
go
sir,
ahead. Yeah.
Okay, sir. So he'll not be knowing what kind of, basically he'll not be exposed to the methodology of research, and he'll not be knowing what kind of cases he will be getting in that particular institute. So in that extent, the teaching faculty should make a list of possible topics which can be done at their institute using the postgraduates. That builds up basically their research aspect, their publication capacity, and their publications also. Towards this, teaching faculty should be more active. That's my point, sir.
Yeah, Lakshman, I just thought about mentioning the same point.
Yes.
I remembered my guide, Professor Tanga. when I joined my postgraduate studies, he was a tough master, like, that in all this. I think there is a lot of role from professors and teachers in choosing a topic. Based on what cases we were getting there, he would give a thesis topic to their students. You take up this topic, you take up this topic. And it was sincerely followed, like how it has to be done. There was no question of, making up cases and all that, because he would know exactly what is the kind of case flow that is happening and all that. And also it is something like new. We were supposed to work hard. In some of the colleagues, I remember that they used to take up a ready-made thesis topic, like, which is already available in some other university. They'll just copy and paste it and just change the numbers. But that wouldn't happen with us. We had to work hard, and he would see to it that we have done a proper job. So I think there's a lot of responsibility from the professors and teachers, as rightly it has been discussed. What kind of caseload is there? What is the sensitive topic? And they used to take up from the recent advances, the journal club and all that. They also used to read. And what is coming up, what is new, and what is feasible in the institute. They used to think whether it can be done in your institute. And then they used to give the topic. So this kind of thinking has to come from the teachers and the guides. And I think the students also has to respond when they give it. Look, this is the kind of work what I expect from you. Only if it comes, then I'll forward your thesis. If he tells right from beginning, and he would count, the thesis submission used to happen about 3 months before, because he would meticulously check the references and cross references. He used to ask us to give us the Xerox copies of those references. He used to read them, including spelling correction, grammar correction. He used to spend nights, and we also spent there with him hours together like that, correction and all that. So I think there's a lot of commitment. Probably it cannot happen to that extent now, but I think with advancement in digital technology and all that, it must be much more simpler to check the spelling, grammar, all that thing. I think references and all that. I think initiation has to come from us also, I suppose.
Right.
This is just a comment from my side.
Well taken. See, there are, for the students here, there are 2 points of view. One, I put forward, both points of view are correct. Please understand that there's nothing incorrect about either of them. We recommend, and we follow it in our institution, to talk to the students and ask them to come up with a topic. More often than not, they cannot come up with a topic. We know that. But we don't straight away give the topics to them like what Dr. Sopimat suggested, because we want them to think about it. We will have a list of topics ready. And then when they come there, we ask them first, what have you thought of? And we let them talk. One way of getting them to talk, getting them to know us, getting them to know whether they've done some work or not is that. Many times what they put out is sketchy, and we guide them through that, and then slowly introduce topics and say, you can take this topic and do it. Sometimes some students come up with good topics. That's also happened. We encourage them then to design a protocol using the topic that the student himself has done. Now, what are the 2 advantages of giving them the opportunity? A, they think about it. It's not that something is given to them. They think about a topic, so they would have done some reading and some idea of what it is. Second, they are motivated because it is theirs. We have not given it to them, so it's their topic, and so hopefully they'll be more enthusiastic when they do the study. Now, we have talked about the basic guidelines.
Sir, one important question one person has asked.
Yes.
What can be the sample number so that we can choose the topics?
I will come to that. Yeah, I'll come to that in a minute. It is there further in the slides further on. Okay, it is there. Now, the point is, once you have chosen the topic, we have told you what are the rules. Once you know what kind of a study you're doing, retrospective or prospective, you have to draw up a protocol. My next few slides will tell you about what a protocol is and how you draw it up. Only the outline, because it's quite a detailed topic by itself. But then once you draw up a protocol, you've got to go back to your seniors. It may be your immediate student senior, second, third year student. It could be your guide or a co-guide. Your department will have told you who these people are. And then you have to look at the permissions. You cannot do a study without the permissions. The permission starts from the head of the department, from the head of the institution, and the institution will always have a scientific committee and an ethical committee. Scientific committee looks at the scientific veracity of your study. It's a one screening committee which tells you, okay, your thesis protocol is reasonably good. If it's not good, they'll again tell you, the changes that you have to make. And then it goes to the ethical committee. Ethical committee is a very important committee that you have to convince. It not only has doctors, it also has judiciary people, social activists, and things like that from the lay public, which is designed to make sure that your study in some way does not harm the subject. It doesn't harm the patients on whom you're working. Now, these are the steps that you have to do before you can actually do the study. It's not my intention to go into details of this, because remember, this is an introductory talk or a discussion. The important thing in all this that I have told you, I've repeated it so many times, is that you must become a team person. You must be outgoing. It is a basic requirement for a surgeon. You can't be a gross introvert. Many of us are introverts. I was a big introvert until I went elsewhere and then learned to be a little more of a team person. Right? Become a team person. Talk to your seniors. Talk to your colleagues. Talk to the paramedical staff, the nurses, the ward boys, the ayas. They are extremely important. And talk to the other people. You will have to interact with biochemistry, hematology, radiology, microbiology. You have to deal with all these people. So they're all in their own little rooms in the corners. So I was telling my students in Sagar all the time, please go to the blood bank. They have a lovely blood bank. Go and talk to the person. And the blood bank officer, who's not there now, who was there a few years ago, was extremely happy to have them. The pathologist is happy to have them. The microbiologist is happy to have them. Go and spend time, talk to them, get to know them, because you will be interacting with them in the course of your study many days, and then you need to have them as your friend. So become a team person, and it will improve your personality as a surgeon, because basically as a surgeon, you are a team leader. Sorry about the disturbance here. Basically, you're a team leader, and these skills that you learn are the soft skills that are extremely important for you as a surgeon. Now, I don't worry about this slide and the URL at the top, okay? Because you will have this presentation with you, and you can just go on to this. DNB has a lot more information from what I can see on thesis and thesis writing, and they conduct workshops, and these are all available free on the net. Just go into this PDF. This is a URL for a PDF file, and that will give you all the information. So the exercises that they give you, the group works in their workshop is this, and they describe the workshop in this document. Just reading the description, you will learn a lot about how to write up a protocol. Please understand that. Now we come to the basic issue of a study, and what is the topic that you want to choose, and what are the questions you ask before you finalize your protocol. Okay, I have told you so far the broad outlines, number of cases available, relatively short follow-up, prospective, retrospective, whatever. What are the details that you need to know? Is the issue relevant to your specialty? If it is something quite irrelevant, nobody will look at it. Nobody will accept it. Is it common enough? Is it issue very common and has been done by many researchers? Please remember what Rajan told you. If it has been done, if the same topic has been submitted within the last 3 years, I'm told they will not accept it. Is it so rare and that very few people have worked on it? Yes, it's a good topic, but will you have enough patients? That is the question. Can the research be done within the resources that you have? Library, equipment, lab facilities. Can it be done within the time frame? This is a recap of what I have already told you. Approval from ethical committee. Will your data collection techniques and tools be acceptable by the study population, cases, and where do you intend to collect it? Can you do tests on people? Will they accept that kind of a test? If you say, I want to do an invasive classical venogram, not a Doppler, they may say, I don't want to be punctured for your study. Okay, you need to get an informed consent from your subject. So you need to understand that. And do you have the facilities for data analysis? There are two things I can tell you, that the library facility and the data analysis facility have practically gone out of the equation. The world is flat. There is enough material, enough scientific material on the net available free for you. So getting a literature search and getting the required information is not a problem. So is it with data analysis. You can do it with many programs by yourself, or with help from people like Ramakrishna, who are very good at it and are willing to help you. And a lot of things can be done. So these two are some things that you need not worry about. And so we come to the last 2 or 3 slides of my presentation. You have to find a thesis for your protocol. You have, again, this is taken from the DNB side. It is no different for the MS. It is the same for the MS. All right. You must have some basic information about yourself. And I'm only talk about the headings. Please remember that even though the headings and the order that you write your protocol and your thesis in are about the same, like introduction, review of literature, aims, materials and methods, references, pro forma. This is the way your thesis is going to be submitted. What you write will be in a different order. Don't think it's the same order. For example, as this study is going on, you can work on the review of literature. Okay, your aims and objectives will of course be ready to start with. Your materials and methods will be ready, but you will have no results to work on. So you don't have to wait for the results for you to write an introductory chapter or a review of literature chapter. So the order in which you write these things will vary, and at your convenience, as I said, just like you're learning your surgery, you're reading your textbooks to learn about operations and surgical diseases, also work on your literature search and keep writing parts of your thesis on a regular basis. Don't keep it for the last minute where you may not have the time. And also remember, you want to get your thesis work out of the way. Your thesis work out of the way, because you don't want the thesis work to interfere with your final preparation for your final MS or DNB. That is your goal. And in the last 3 to 6 months of your course, you should be busy reading your surgical topics, getting prepared for the difficult examination that you're going to face. I don't mean to scare you by saying difficult, but it is a challenge and you need to get ready for it. And you honestly don't want to be, for your own good, burdened with this thesis work which you have to keep running and writing to submit within a given time. So please start working on different aspects of thesis from day one. Keep everything in a nutshell. And in these days of computers, you can change anything at any time. In my days before the computers, we had to type everything. And once you type it in, to erase it and put something else was very difficult. We had to redo the whole page. And if you had information where 2 or 3 pages were changed, the whole thing would go haywire. And so you don't have that problem. You can put your material wherever you want, whenever you want, and then keep everything, and then you can rearrange it at the end of the day using your word processor. And so doing a thesis is actually very, very simple. So I have basically touched on the philosophy behind a thesis, trying to choose a topic and trying to work towards getting a thesis done. And I would very much like the teachers in the group to add to what I have said. And thank you very much for your patient listening. Rajan, some remarks, concluding remarks? I haven't seen all the participant list here, but yeah, I would very much like you to please participate. Rajan, are you there?
I think he is not
there.
Not there.
Okay.
Yes.
Divakar?
He is there. He is there. He must be somewhere away, sir. He is
Okay.
there.
Divakar, hey, you have anything to add or anything else to subtract or whatever?
No, sir. There was a suggestion from Nuli, sir, from
Yes.
KCASA side. Apart from your part, I don't have anything to add for that.
Sir, Nuli, sir, yeah, I meant to answer your question, but I did not. Yeah. I'll answer Dr. Nuli's specific question. I can only answer it by saying what we do in Sagar Hospital. All right. And it's something which has worked for us very well. And other departments can work towards it, or they may actually give us suggestions how we can even improve it if they're doing it better than us, which it is quite a possibility. I admit that. Now, when the student comes, we usually talk to them ourselves and then say, look, you got to get your synopsis ready, and then tell them about how to do it, some basic things. We actually do it over a cup of coffee. We don't have a regular class for it, just talk somewhere in the cafeteria and say, get this going. And then the seniors, of course, will talk to them and say what cases are available. And they come up with a set of subjects. But we have one very formal event or a series of events that happens in Sagar, which is, I think, a requirement for any department. We have separate from our teaching sessions, forget about our lecture series or subject seminar. Apart from all that, we have what are called research meetings. Both the research work that we do, from which we publish our papers, and the thesis work are discussed there. And so we get our students to come there, have some topics, and we will have kept on thinking about topics, and we'll have a list of 7, 8, 9 topics. And so we give it to the students and then tell them, I'll give you 3 weeks, 2 weeks, come back with a protocol. We also send them references. Just to make it easy, we actually spoon feed them, and some of my colleagues have told me that that's not a good thing, but just to make it easy for them because they're very new, we send them a few reference articles, a few other articles, and say, look, this is what you have to read up, 10 or 12 articles, read it up, and then know what you want to do, come with a protocol. The protocol will be very, very sketchy. They will not be experienced in it, but again, their seniors will have given the first correction for that. And when they come with the protocol, we sit there and, many times in the meeting or sometimes by email, we go through the whole protocol and then change it the way it has to be done, taking into account particularly the confounding factors, confounding variables. So we tell them you have to check this, do this, blah, blah, blah. And then we then sit with them and correct their informed consent form. And then we help them apply it to the scientific committee and the ethics committee. So the whole thing is nicely structured, and maybe not in 3 months. We would like to have it in 3 months, but students being what they are, they never come back in time. But definitely by 4 to 5 months, their work, thesis work will be underway. Nuli sir, does that answer your question?
Yes, sir. Thank you. Only thing is, sir, how about having one session in our annual conference, cancelling one free paper session and asking the first year PG students about their topic, what they have chosen, and people like you and other professors can discuss on topics, and we can guide on the stage itself to the students, sir. What is your opinion on that?
Sir, I mean, it will be good for them, but it won't help them practically because they would have probably submitted their synopsis and started the work. So the same, instead of in a conference, the same thing can happen on a webinar. What COVID has done now is that it has given us a taste of a very effective way of communication. Any institution, any number of institutions, all we need is the enthusiasm and the interest of the teachers concerned and the students concerned. So we can have a webinar on any institute, one institution at a time. For example, they can choose their topic, they can put up a framework of the protocol, and what we do in Sagar can be replicated on a webinar by many people. In fact, many more minds will be working on it, and we can fine tune it even better than people from one institution. So that would be a very welcome thought, and KCSI can offer it, and institutions who are interested can take up that offer. So
Sir, Lakshman sir.
Yeah.
Lakshman sir, Girish here, sir.
Hey, Girish, please. Yeah.
Hi, sir. Thank you for your nice talk and nice this one webinar, sir.
Yeah.
Every time we are seeing your candidates who are coming from Sagar Hospital, one or the other, all have presented their papers. So in a state level or midcon or national state level, they have presented their papers. So all the institutes can make a compulsion that whatever topic has, they can by second year or third year, they have to complete that topic and they have to present there in the state conference with a good presentation, and that can help them also, sir.
Yes, indeed. Yes.
And in our institute, sir, in BM Patil Medical College, in starting, say, we are conducting a thesis meeting, a review of the meeting, and then it will go to principal office. There also everybody is called, and the topics are discussed by all staff. All HODs will be sitting. All the HODs, all the department HODs will be there, and then we scrutinizing it. And later, for every 3 or 4 months, we have got a thesis completion, even meeting
Review.
also in the medical college.
That's all that is required. That is all that is required. And if all institutions take it up and do it sincerely, we will have a tremendous amount of evidence and research and papers and publications from the state. And that is our goal. No,
And-
Karnataka
and most
must be the model for
And most of the Sagar PGs are our role models to our students also, because every time I have seen in the list of 10 or 2 or 3 will be there from Sagar Hospital.
Thank you, sir. Yeah, thank you. But yes, I think all institutions must show interest, and the boys, they will have inertia. They will not really be enthusiastic, but the department must insist and get these things to be done.
Sir, Dr. Shravante's question, sir, the sample
Yeah.
size.
Yes. No, this is a very important question. I'm glad you reminded me about it. You see, as a student, you must know about the calculation of a sample size. I won't go into it, but Dr. Ramakrishna's lecture and his slides will tell you very clearly what it means. What it means is, in short, you are taking information from your sample of 30, 40, 50 people, and you're projecting it to say this is good for the whole population. Now, are you correct in saying this? You will be correct if you have a large difference between two groups. You will have a small sample. Okay. If the difference between TEP and TAP is very large, as an example, don't take it as the truth. Suppose TEP and TAP hernia has a large recurrence rate, then the difference will be shown up to be true even with a small sample size. But as the truth is, because the difference is hardly anything, to know whether there is really a truth in that statement or not, in that research question, you have to study thousands of patients, which you can't do. So sample size is important for you to know whether the difference is really true or not. But I come to the nitty-gritty of the problem now. In asking students to write a thesis or a paper, particularly a thesis, paper, it may be important to have truth, but in asking you to write a thesis or a dissertation, we are not asking for earth-shattering research from you. We just want you to know that you know what research is and how it is conducted, what a protocol is, and a part of that is to learn to get sample size, or learn to get sample size. The reason I'm saying it is that you do a sample size, say, I must have 100 patients in each arm. 100 patients in each arm. You won't get 100 patients. You will get only 40 patients. That will not disqualify you in your thesis work. Please take it from me. I have, in fact, particularly this year, it has always been discussed about in the past, and I had the opportunity to discuss it with the Vice Chancellor of RGUHS and told him, there is COVID, hardly any patients, hardly any surgical work. How do you expect people to have the patients to write a thesis about? He was very clear, at no time are we going to insist on the numbers, because there are two reasons. A, we don't expect you to produce some earth-shattering evidence, as we told you first, and B, very important that you don't make up numbers. You don't tell a lie, because what happens is, if the university says that if you have less than the calculated sample size, I will disqualify you. So your target is 100, you have 40, you will just multiply it by 2.5 and your job is done. That is not what any of us want, not even the university wants it. Please take it from me. Sample size has to be calculated and say, this is how I did it. I was hoping to get this number, but I did not. So I'm restricting my analysis to only 40 rather than 100. And in your discussion, you say that at 40, at a sample size of 40, there is a trend for surgery A to be better than surgery B. But I cannot say this is applicable to the whole population because I do not have the required numbers. Truthful, correct, and scientific. And that is all that your teachers and your university expects. And I can say categorically, you must know how to calculate sample size, but if you have less than the number, you do not have to cook it up. The university, I know, will accept it, but you have to put it in your discussion as I explained to you. I hope I have made myself clear.
Can I say?
Please, Rajan.
Yeah, absolutely true what Dr. Lakshman has said, and very clearly so. What is important is this whole process of writing the theory, the thesis down, is to learn the way scientific work is done, learn the process by which you mine data for literature and other things for figures and facts and put it down in a logical sequence. As he said, sometimes you're not able to meet your sample sizes. That will not disqualify your study. What you have to do is during the discussion, very clearly, it comes under limitations of the study. And at that point, you describe and say what the problems were, why you could not reach the given sample. But if the process of setting up the sample and your collection of data falls into place, the thesis gets accepted. It is not that you have to find a new research or a new point or something to add on to surgical literature. It is a point, it's a method, it's a cognitive function that we want you to learn about scientific ways of reading, understanding, and being able to reproduce this kind of thing for your own good and future. So sample size is important, but not essential. Thank you.
Shivram, you have something to add?
Can I come in, sir?
Please do.
Dr. Aruna here, sir.
Please. Yeah.
Sir, excellent talk, sir, as always.
Thank you.
Thank you for that. And being a member of the ethical committee here in WIMS and also for the DNB students in district hospital, sir, I'd like to tell the postgraduate students there that now you have heard about all the aspects from your side, from the teacher's side, and from the subject side. I think we have to remind them, very important, not to forget the center point of this, the subject itself for the participating patients. We have a duty towards them. The students have to primarily first respect the dignity of the person or the patient they are studying on. That's very important, sir. And please do respect them, their privacy, their health, and their life sometimes. That's one thing. You have to put it in front. The other thing is about the consent. Very important that they inform the patient or the subject regarding the study they are doing, if it is a prospective one, and tell them in detail in their own language. That's very important for them, and take a written consent also, sir. And if they're going to trespass anything in the course of time, they have to inform both the ethical or the selection committee and also the subject. That's very important for them. And also, please, the privacy of the patient has to be kept in mind when they are examining them or doing any tests or anything on that. I think that's it, sir. Thank you.
Very good. Very valid points, actually, Dr. Aruna. Yes.
Thanks.
Shivram, anything to add before we
thank you, Lakshman.
Yeah.
I think it was a very nice talk.
Yeah.
What I was thinking was from KSC ASI side, twice a year or so, we can do this, run the course when the postgraduates join, the fresh postgraduates when they have not yet decided about the thesis topic. So I think KSC ASI can help them to choose their topic by a talk like this. Also, if they have problems, I think the scientific committee of the KSC ASI can guide them whenever they want help. KSC ASI is always with them for any help they require.
Yeah.
Thank you.
Thank you. Can I hear from some of the students?
Can I add?
Yeah, please go ahead, Arvind, please.
In continuation of to Dr. Shivram's this thing, already there is a plan for division-wise this topic to be completed within the first 6 months of the period of post-graduation. First 6 months is very important. Within that period itself, let us cover zone-wise. So because of this, I think our state election, it is being delayed, and Midcon also.
Right.
I think Divakar has already told. We will be, the next will be from the Bijapur division. Already Jaspal is working on that.
All right. Any comments or questions that have gone unanswered? I couldn't look into the chat box as I was talking. Any questions or comments from the students, please? Very welcome. Please understand that you should not be inhibited in asking questions or making comments even. You are allowed to disagree with what we have said. It's not a problem. We are mature enough to have an open discussion with you. That is science. All right. So any questions or comments from the students? Silence as usual. All right. So, Sopimat, can you please give the concluding remarks and we'll end the meeting, please.
Oh, I think it is an excellent talk by you, and such focus talk probably will guide the students more effectively rather than I think one large program, because people cannot focus on many topics at a time. I think this is how one can really focus on, the first step of any research or a dissertation or anything like that. I think with this, we'll take it forward and cover up the rest of the topics slowly once people get the grasp of it. I think it's very important because we are concentrating more on qualities of the paper that are being, presented at our conferences. So I think this will definitely help the postgraduates in moving in that direction as to what is expected from the seniors, teachers, and the judges and other persons like that. I think it's just a first step what you have taken. Hopefully, it will reach slowly bigger heights in the days to come. And I'm sure that many students and faculty will be benefited by that, like this, just like me and rest of my colleagues. And hope that things will pick up. And only one request for all postgraduates and faculty who have attended this program is to spread this word among your colleagues from rest of Karnataka, so that their people will get a little more interest and get motivated to attend such programs whenever they arrange in other zones. That's just my request.
Yeah.
Thanks
So,
one and all. Thanks to seniors,
thank
Shivram,
you.
Rajan, and my colleagues, Arvind, Nuli, and all that, and all of my colleagues. I cannot see all of them. Thanks to all of them for being with us. And their mere presence itself is a great motivating force for the youngsters. With this, I compliment you and hope that it will be really good program in the days to come.
Thank you. And before I go, two things. You have my email on my presentation, klakshman58@gmail.com. Feel
Yes,
free.
sir.
Yeah, go on.
Yes, sir. I have a doubt. Actually, it's very good session actually.
Yeah.
So, what is the question is like you are telling that not to repeat the thesis topics. See, is it the topic not to be repeated, or is the study not to be repeated? Because if we take hernia, there will be so many thesis topics, so many thesis questions. The questions raising the comparative questions.
Yeah.
So we can repeat hernia, but we shouldn't repeat the question for which we are doing thesis.
Excellent. I think you have hit the nail on the head. Congratulations on raising this point. Yes. When we say thesis topic should not be repeated, we actually say don't repeat the same research question. All right. You can have 10 papers on the subject or topic of hernia, but the research question for each of those papers must be different.
Yes.
Right? Yeah. Perfectly right. Perfectly.
Thank you, sir. Thank you, sir. Thank you so much.
Yeah.
I think we have made a difference, Lakshman, by these talks. I think people have started asking such questions. Itself is a great change that is happening.
Absolutely. And so, you can be, even less inhibited when you write to me or any of us. You get our emails from everywhere, from the website. We are all very interested teachers. We are here to help you. Feel free and drop a line on any aspect of your surgical study. Okay. klakshman58@gmail.com. You can write to us anytime. And you have a lot of people, and all of us who have been talking today, Rajan, Shivram, Nuli sir, Dr. Sopimat, Arvind, Divakar. I just named a few, but there are many who are interested. And so please go ahead and write to us and we'll be very glad to help you. Thank you very much for your participation.
Sir.
Yeah, sorry, go on.
Yeah, this is a Ballari City Chapter City
you have to
program, sir.
Sorry, okay, go ahead. I forgot. My fault.
We'll ask City Branch President Dr. Prabhu Hubli to come in and make some comments. After that, I request Dr. Khalid, Secretary, to propose vote of thanks before we conclude.
Correct. Thank you. I stand corrected. You're absolutely right. I'm sorry about this caught-up. Yeah. Sorry.
Sir, can you hear me, sir?
Yes, indeed, sir. Prabhu, sir.
Yes, sir. I am all the way. I'm attending your excellent talk, sir. This is definitely very much useful to all the fresh PGs. Actually, we are failed to do this so far, but this time it is really a wonderful session we had. We really thankful to you for
Thank you, sir.
making such event. Okay, sir. Thank you very much, sir.
Thank you very much, sir.
So, excuse.
Go on. If there's a question, please go
Yeah,
ahead.
Shravanti,
Don't
please go ahead.
hesitate.
Yes, sir. What I want to ask is it necessary to do always a comparative study, sir?
Comparative studies are better because you get quicker answers and you have statistics to play. And research questions generally compare one intervention with another intervention. So if you have no comparison, but only an epidemiological, only a what is called an epidemiological study, then it becomes less useful in surgical realms. It may be very useful in a subject like COVID, for example, vaccines and things like medication even. But for surgical studies, comparison studies are preferable. I'm not saying it has to be only comparative study, but it's preferable.
Thank you, sir.
Hello, Dr. Khalid. Can you propose vote of thanks?
Khalid.
I am unable to see him on this. I request Pawan to make. Yeah, Pawan, you only can propose on behalf of Ballari City branch.
Sir, thank you, Dr. Lakshman sir, for a wonderful talk, and I also thank all the delegates who have attended, including the eminent teachers like Rajan sir, Shivram sir, and Sopimat sir, and Chanana sir, Arvind Patil sir, and Prabhu Ubli sir, and hope we will see this type of topic in the future again.
Thank you. Thank you very much, Pawan. And yeah.
Thank you.
Thank you.
Right. With your permission, we will end the meeting. Thank you very much and good night, everybody.